Hi, welcome to Chapter 10. We're going to talk about the maltreatment of children, and we're going to look at abuse and neglect. So, facts concerning childhood maltreatment. 5 children die every day from child abuse. 50% are children under the age of 5. Approximately 600,000 confirmed cases of child maltreatment occurred in the U.S. Super sad statistic. But the actual incident of maltreatment is estimated to be 3 times greater than reported. Oftentimes, children that are abused do not report the incident. What happens to children who are victimized? Approximately 230,000 children are placed in foster care each year in the U.S. So victimized children are more likely to engage in drug abuse, juvenile crime, become pregnant, experience depression and other mental health disorders, and commit suicide as they grow up. They are at a greater risk for performing poorly in school, repeating at least one grade, and requiring special education services. So remember, behavior communicates something. So a lot of times kids that are performing poorly, just look at the overall, behavior, how are they doing, does not mean that they're being abused in any way, but it could be one of the warning signs. Okay, so we're going to get a little bit more into that. So what is the definition of maltreatment? Any situation in which a child is not safe in his or her environment because of injury inflicted by a caretaker, exposure to hazardous conditions resulting in inadequate protection, exploitation of any kind, and withholding of medical treatment. For example, if a child has a toothache or, something, their gums hurt or some type of medical treatment, they're not getting the help they need for that. The challenge. So the moral and ethical dilemmas. A family's rights versus the law. Abuse treatment is often a continuum. So a lot of times the discipline starts. If a child doesn't listen, then the abuse will go. My advice too is never, ever, ever hit a child or spank them when you're mad. You do not ever do that. You can hurt a child. So a lot of times in these situations, the parent is using too much force or other, items that they're hitting with, which is not appropriate. Is child maltreatment a new or contemporary problem? So here's a historical overview. So in our chapter 10, it kind of goes over each of these areas. So I would love for you to look up the historical overview of each one. And it talks about especially one of the acts in 1974, the Prevention Act. Again, go over that in your Chapter 10 textbook. And then there's certain categories of abuse and neglect. So abuse may be physical. Have you heard of shaken baby syndrome? This is something where it's advised never ever to shake a baby. A baby's neck is not strong or formed. Sometimes parents get overwhelmed or anxious because the baby is crying. So what you never ever want to do is shake a baby. It could hurt their brain and their head, and often will result in death, or the child will become disabled in some way. Okay? Other abuse is sexual abuse, emotional or verbal. Physical abuse could also include hitting a child with some, the belt or something. Neglect is physical or emotional neglect. Physical abuse is described as unexplained physical injuries. Child may appear frightened, aggressive, withdrawn, or apprehensive. These are some, unexplained physical injuries. Okay, so the child may, not really give you the right answer, or it seems a little odd. The child may seem frightened. Some children are aggressive and do the same thing. Some are withdrawn or apprehensive. With sexual abuse, is any sexual act performed for adult pleasure, including inappropriate touching of any kind, physical contact or indecent exposure. Child may have excessive curiosity or advanced sexual knowledge for their age. So that's one of the indications. I had a little child before that knew extremely advanced sexual knowledge, which was very strange. And I did look into it, and there was some sexual abuse in her past, which she did have actually some therapists that were involved in the school. So I did notice that before. I knew that she had the therapist in the schools and that she had an IEP plan, but I did notice that she definitely had much more knowledge than her age. Again, emotional or verbal abuse is excessive and repeated name calling, could be belittling or other negative remarks. And some of the signs of this child that is being emotionally or verbally abused is a child may appear anxious, have persistent fears, sleep disturbances, and behavior problems. And physical neglect is a failure to meet child's basic needs and protection from harm. So the child may comment about absent caregivers. So some of them may say that their parent's not doing A, B, or C. And emotional neglect is a lack of interest or responsiveness to a child's psychological needs and development. Children may appear afraid and distrustful. And then again, the dynamics of maltreatment will go into the characteristics of adult perpetrators. So most cases involve someone the child knows or trusts. Oftentimes it is a family member, relative, a babysitter, neighbor, someone that they know. 4 out of 5 victims are abused by at least one parent. More often it is the mom. Often experience acute or chronic environmental stresses. So again, with these adult perpetrators, oftentimes they are in poverty. They themselves have relationship problems. Most of them are unemployed, live in social isolation, and lack of outside support. So they also lack the knowledge about child's development in raising children. And they use or abuse alcohol or other substances or drugs. Here are the vulnerable children. So no group of children is immune to abuse and neglect, unfortunately. Boys and girls experience maltreatment in almost equal numbers, but girls are 4 times more likely to be sexually abused. Children under 3 and 4 are the most vulnerable. Why do you think that is? Why do you think 3 and 4-year-olds are most vulnerable? So just take a minute and think. When they're that age, they're very gullible and easily, you're easily able to manipulate children. So that's why that age group is a little bit, more vulnerable. Children who have disabilities are also at a higher risk. How do you know if a child is being maltreated? So a combination of behavioral and physical indicators are typically present. Maltreatment is often a behavioral pattern. So like I said, each behavior that is shown is really showing a pattern, and it's communicating something. Okay? Who is required to report? Mandated reporters. Who are they? They're teachers in any child care facility or school, any medical professional, social workers, any police officer, law enforcement, and any person with reason to suspect a child has been injured by physical, emotional, or sexual abuse or neglect. So the goal for prevention and support: provide quality care and education for families. Also develop reciprocal relationship with families, recognize risks and signs of abuse, build on children's family strengths, be informed about professional responsibilities, and help children develop resilient skills. Thank you so much, and that's the end.